Okay, so I'm about to take you through the pre-exercise screening tool, and the purpose of doing this is to ask you a series of questions to try and get as much medical information out of you as possible. The reason we're going to do this is to identify what's called contraindication to exercise. So this is anything that could be present or harmful to you during exercising.
Yep.
So there's 2 stages of questions I'll be asking you, and these are going to help me to determine an exercise program appropriate for your level and what intensity it should be at.
Okay.
But the most important purpose of the pre-exercise screening is it tells me whether or not I need to refer you to get a medical clearance from a doctor or not.
Yeah.
So are you happy for me to go ahead to do this? Okay, cool. So the aim of stage 1 is to identify individuals with known disease and or symptoms of disease who may be at a higher risk of an adverse event due to exercise. So this could be an unexpected event that occurs as a consequence of an exercise session resulting in ill health, physical harm, or death to an individual.
Yeah.
So question 1, has your medical practitioner ever told you that you have a heart condition, or have you ever suffered from a stroke?
No.
Question 2, do you ever experience unexplained pains or discomfort in your chest at rest or during physical activity? Question 3, do you ever feel faint, dizzy, or lose balance during exercise?
No.
Question 4, have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Question 5, if you have diabetes, have you had trouble controlling your blood sugar levels in the last 3 months? No. And question 6, do you have any other conditions that may require special consideration while exercising?
No.
No. Okay, cool. So now I just want you to describe your current physical activity levels in a typical week. So how many times a week do you work out?
Probably 4 at the moment.
4. And are these light or moderate sessions?
Probably moderate.
Moderate?
Yeah.
And how long do you roughly work out for?
Hour every time.
Hour every time?
And then stretch on either side of that.
Yeah, cool. So that's 140. Okay, now we'll do stage 2 questions. So the aim of this one is to ask you a bunch of more questions just to find out some more information. So how you 18?
Yes.
And male. And do you have any family history of heart disease?
No, not that I'm aware of.
Do you smoke cigarettes?
No.
And we can do that one. So your weight was
82.
82, and your height
6'2".
in centimeters, you know?
187.
87. Okay, cool. And have you ever been told that you've got high blood pressure?
No.
Have you ever been told you've got a high cholesterol?
No.
Have you been told you've got high blood sugar level?
No.
Are you currently taking any prescribed medications?
No.
Have you spent time in hospital in the last 12 months?
No.
Are you pregnant?
No.
Just had to ask.
Thank God.
Do you have any diagnosed muscle, bone, tendon, ligament, or joint problems that you have been told could get worse? No. Okay, cool. Sweet. Well, now we'll move on to the next stage.
Cool.